now the most important question that's on everybody's mind. Is the situation alarming on globally, or is it worrying in India with regard to the virus?
No. The reason for alarm mostly is uncertainty. We know how COVID behaves now. Unlike in 2020, it was an all-new disease. We had no weapons against it. There was no treatment known. There were no papers published. There was no vaccine. So it's a very different situation now. Doctors across the world, including in our country, know exactly how to tackle this condition. For the most part, information is the most powerful tool, in my opinion, because how COVID was conquered was really the power of information, the power of correct information, not only to provide good quality information to people, but also to curb misinformation. So on both counts, interviews like this have helped keep the COVID cases down. For example, people now know how to stop getting infected to start with because we know how it spreads. It spreads through what spreads almost like cigarette smoke. Like if I have COVID, when I talk or when I interact with people in a closed space, people around me will pick up the infection. It need not be through coughing and sneezing. So that is the major new development that occurred since COVID arrived on the scene. So if you are in a closed indoor space with lots of people, you might want to wear a mask, especially if you are vulnerable. In an outdoor and less crowded space, it's very unlikely it will spread unless you're talking with someone in very close contact. Periodic washing of hands and fingers after visiting public places is always a good thing, not only to stop COVID, but also to stop other viruses and other infections from entering our fingertips. Visiting people in hospitals is a social thing out here. I would discourage that because people tend to bring viruses to hospital and back. And the other thing is, if you have a fever, which is uncomplicated, stay home. Don't mingle with other people. So that will minimize the chance of spreading whatever you have to other people in the community. And if you have unusual symptoms or prolonged fever, by all means, seek medical attention, talk to the doctor, see if anything needs to be done. But for the most part, for the vast majority of COVID cases, they can be treated easily at home with rest, plenty of fluids, paracetamol if there's a high fever, good nutrition, and with very little medication.